Now starting. All attendees are in listen-only mode.
Hi everyone, good morning and welcome to today's webinar. My name is Zachary Gersten and I'm the Fellowships Coordinator out of Tufts University. Today's webinar is titled Pushing the Frontiers in Agri-Nutrition Methods and Metrics because we have a really special event today. We have our Round 1 Fellows who are all online and ready to share their research with you all today. They're going to cover diverse topics such as animal source food and food systems, school feeding programs, women's time use in agriculture, among many others. But before we get started, I'd like to go over a few items just so you know how to participate in today's event. We'll have a question and answer session at the end of the webinar, but please feel free to send questions as the fellows present. You can do this by going into your chat box in the panel to your right, selecting Send Question to Staff. There's a drop-down menu right below the chat box, and you can just send your question in. We have staff who will curate these questions as we go along, so we can come back to them at the end of the webinar. If you do encounter any issues, please email us at IMMANA, I-M-M-A-N-A, fellowships @tufts.edu. We have our communications assistant, Caitlin Joseph, who is also online. She will be monitoring the email account throughout the webinar. Before we get started, just a little housekeeping. If you are interested in applying for a Round 3 fellowship, be sure to check out our website and the call for applications. We will not, maybe you've seen the posts on Ag2Newt. We will not answer any questions on applying to fellowships today. But if you do have any questions or concerns, please email us, and we will have an informational webinar for you all to attend on December 8th. And just again, before we start, I do want to take this time to thank all the fellows for agreeing to present their work today. We had a very exciting first round, and none of this would have been possible without all of their innovative perspectives on the issues that we're covering today. And I also want to thank Joe Yates and Caitlin Joseph for developing this webinar and providing such great communications platform for all the fellows to share their work. So without further ado, we're going to start with our first presenter, Dr. Rosemary Isoto, who will present her work conducted at the Makerere University with support from her mentors.
Hello.
Hi, Rosemary.
Hi, everybody. My name is, hello, Zach. Thanks for the introduction. Hi, everybody. My name is Rosemary Soto. I'm coming to you from Kampala, Makerere University, and I'll be presenting on my work that I've been doing for the past 1 year, entitled Nutritional Barriers to Agricultural Productivity in Smallholder Farm Households, Panel Data Evidence from Uganda. Next. Next. So in sub-Saharan Africa, about 47% of the lives under $1.25 a day, and about 206 of the 807 million malnourished people live in sub-Saharan Africa. That is whopping about 26% of the population being malnourished. When you just come down to Uganda alone, as of report by FAO 2013, about 33% of the population is malnourished. That's such a huge number. Next. Next. So the objectives of this study were three. First of all, I wanted to assess the impact of nutritional intake on agricultural productivity and hence labor productivity. Also, I wanted to examine the gender differences in deficiency of these nutrients and the resulting effect on productivity. And finally, I wanted to assess the threshold levels for macronutrient and micronutrient intake needed to achieve some level of agricultural productivity. So specifically, I focus on macronutrients such as calories, proteins. I also look at other nutrients such as iron, calcium, vitamin A, vitamin D, vitamin C in this study. And basically what I want to show is that, much as other studies previously have said, that the nutrient productivity relationship is kind of no longer important, but probably that applies to specifically developing countries. However, in developing countries where a lot of labor is actually manual, you find that maybe this relationship is still very important. Next. Next. So what do I do? Exactly, I use the panel data for 4 years, that is 2005, 2006, 2009, 2010, 2010, 2011, and 2011, 2012 to do the study. And I got a balanced panel of about 1634 observations, giving me a total of about 6536 observations. And this data I downloaded from the World Bank website. Next. Next. So to answer my 3 objectives, for objective 1, I basically estimate a Cobb-Douglas production function in which I have effective labor as a function of nutrient intake. And of course, we know that this has so many methodological pitfalls, some of which include reverse causality, where you find that maybe one of the my outcome variable could be influencing the other, my variable of interest, and the other way around. And also there are so many unobserved fixed effects, such as the genetic endowment of individuals and also other issues that may drive this relationship. So to address that issue, I've used the fixed effects instrumental variable approach. And for my objective 2, what I do is basically to disaggregate my data based on gender and still estimate the Cobb-Douglas production function, still using the fixed effects instrumental variable. And of course, the instruments that I use that are important here, I use, for example, the market prices of the consumption goods. I use also the household variables that indicate clearly how they affect this. And for my objective 3, first I use the multivariate analysis, in which, using cluster analysis, I show that there are 2 categories of this households in this population. Later on, I do the dissimilarity measure using the Euclidean distance between these quantitative variables. Thereafter, I estimate the model using instrumental variable threshold regression in order to obtain the thresholds above which or below which a household is unable to produce as much as to support the family. Next. So briefly for the panel, my descriptive statistics showed that the average age of a household was about 47 years with about 4 years of education, and most of the households were male-headed, about 71%, and the cropland size was about 9 acres. And when you go to hired labor, they really used very little hired labor, but most of it, the labor was family labor. Next. Next. So for specifically look at the macronutrients and the micronutrients that I was estimating in the model, I first needed to see the annual percentage changes in daily intake for the various years. And I could clearly see that, even from the results, you could see that the average calories and average iron generally decline over the period of study, whereas calcium, proteins, vitamin C, and vitamin A all increased over this period. Next. So for the econometric results for objective 2, what I find is that for all the nutrients, in fact, the results were positive and statistically significant, implying that all these nutrients are still very important and lead to increased productivity in developing countries, specifically in Uganda. Next. My other objective that I really wanted to see how this affects gender when you disaggregate the data. What very interesting results here, I find that for all the nutrients of interest, calories, proteins, calcium, iron, vitamin C, and vitamin A, I found that in fact the intake by females increases productivity by about twice that of males, and I found that very interesting result. Next. So when you look at objective 3, this is just visualization of the clusters and basically showing the two categories of subpopulations in this general population. Next. So the results on this page, as you can see, show that generally the threshold value for the different nutrients is as shown there. What that means is that the households need to attain a certain level of calories, proteins, calcium, iron as the threshold that they will be able to operate at their best optimum. Thank you. Continue. Just to some conclusions and recommendations that I draw from this study include that we find a strong significant effect of calories, proteins, calcium, iron, and vitamin C, including vitamin A on intake on productivity as well as labor productivity. Most importantly, we find that women's productivity more than doubles with additional nutrient intake, and from the other results we can see that the households were better off when their nutrient intake was above the threshold value. What policies can be derived here? That enhancing intake of nutrients is very important if we are to be able to increase productivity, and of course also taking gender into consideration. Thank you very much.
Hello, can you hear me?
Yes.
Hi everyone. Thank you, Rosemary, for sharing your work. I'm sure our audience will have questions for you during our session at the end. And just as a reminder, for anyone who's just come online, you can submit questions through the chat pane in your attendee control panel down at the bottom of the screen on your right. And you'll just have to select send question to staff, and we'll receive that question and revisit it at the end of the webinar. But I just want to move on now to Cynthia. Is Cynthia online?
Yes, I am.
Hi, Cynthia. All
Hi,
right.
Zach.
So without further ado, please join me in welcoming Dr. Cynthia Matarani, who will be our next fellow to present.
Thank you, Zach, and hello to everyone. So for my fellowship, I looked at women's time use in rural Zambia in the context of ag and nutrition programs. This work was done in collaboration with CARE Zambia and CARE USA. And next slide. So globally, women spend 2 to 10 times more spend 2 to 10 more time on unpaid care work compared to their male counterparts. And women are also often the primary caregivers of infants and young children. So these burdens on women's time use have serious implications for women's engagement with ag and nutrition programs, and ultimately the impact that these programs have on child nutrition outcomes. So in the time use arena, there are often these 3 R's that are talked about, and these are recognize, reduce, and redistribute, particularly women's time burdens. And as they are ordered, we can only make efforts to reduce and redistribute women's time, women's workloads after it has been recognized that there is actually a burden on women's time. Next slide. In fact, there is actually a famous saying that goes, we don't know how to measure what we care about, so we care about what we measure. And this implies that if we do not measure something, it is difficult for us to care for that thing. And one of the key findings from a 2014 global meeting on unpaid care work was that there is need for context-specific tools to measure unpaid care work. So we sought out first to explore women's time use in rural Zambia to get an IMMIC perspective on women's time use in this context. And secondly, to develop a context-specific tool for measuring women's time burdens, which could be rapidly administered. Next slide. To achieve this, we used focus group discussions to determine activities that women are involved in within their communities and within their homes. And from these, and also to determine how they perceive their time sufficiency on one end of the spectrum and their time scarcity on the other. From these focus group discussions, we then developed our first version of the women's time use tool, which then went through a series of cognitive testing. And cognitive testing is a method that is used to identify any problems with the comprehension or response to questions in a survey. After we validated the time use survey that we had developed through the cognitive interviews, we then administered the final tool to 24 women who were also observed as they went about their activities for 6 hours. These observations and administration of the survey were done on 2 separate occasions, 1 week apart, and starting with the household observations. Next slide. Although we had planned to do focus group discussions with only women, we ended up having some focus group discussions with men as well to explore any gendered expectations around women's time use. And as you would expect, both the men and the women reported that women had primary responsibility for a laundry list of the household chores, and no pun intended with laundry list, but the heavy workload that women have, as well as the little time that they have for rest and leisure activities, also came up in both the focus group discussions with the males and the females. And this is best highlighted by the 2 codes that are at the bottom of the slide. And one which came from the men's focus group discussion was that a woman does not have time for resting. She works as long as it is day, and what makes her rest is night. Next slide. In contrast, the men mentioned that they had several activities that they were involved in for leisure, which included playing soccer, listening to the radio, going drinking with friends, etc. And they also admitted that they could do more to help women, but their tradition and culture did not permit them to do so. And the bottom line from this focus discussion was that we men are lazy, which is also a quote that is on the slide, and that one of the men also say that we can cook, but our tradition says that women should do the housework. So I think one of the key highlights on this focus group discussions, especially with the men, was that if there are any interventions to try and reduce women's workloads to be done, they should also take into account the gendered expectations on women's time use, and also how many of the household chores have been feminized and they need to be defeminized. Next slide. So from these focus group discussions, as I said, we then developed a survey instrument, and the instrument that we developed had 2 modules. The first one is a workload module in which the mother recalls how much time they spent on a list of activities. And the second is a perceived time scarcity scale, which has 6 questions. And in this slide, I've highlighted just a few of the comprehension and response issues that we came across during the cognitive interviews. For example, initially we had a 1-month recall period, and we realized that this was a huge response burden on the participants, and we changed this to a 1-week recall. And there were also a number of words and phrases that were misunderstood by women, and although for most of them we were able to make substitutions to make the questions clearer, we had to drop 2 questions in the time scarcity scale. We originally had 8 and then ended up with the 6. And one of these questions, for example, was that my work often gives me stress, and there is no word for stress in any of the local languages, and the word that we had used in place for stress had caused a lot of confusion in the base compared to the intent of the question. Next slide. So finally, when we had our final version of the survey, we then went on to the household observation phase of the study. And for this slide, it was either the picture or a slide with many numbers, and I chose to go with the former. But basically, what we found from the household observations was that women do spend a lot of time, particularly in farming activities, in fetching water, and in fetching firewood, and this leaves very little time for childcare, and in most cases childcare is done as a secondary activity rather than a primary activity. And as I said at the beginning, this might have serious implications in the impact of the ag and nutrition work that we do in these contexts. So I will leave you with that and hope that you can look forward to reading more about the results on this part of the work in the manuscript that we hope to publish. And next slide. With that, I thank you for listening.
Thank you, Cynthia. You definitely got illuminating feedback from those focus groups. Now we're going to hear from Dr. Matilda Lar on her work with the University of Ghana. Please join me in welcoming Dr. Matilda Lar now.
Hello?
Hi, Matilda.
Oh, you can hear me. Hi, Zach. So thank you, Zach, for the introduction, and thanks to everyone for joining us today. My work for the past year has focused on strengthening the monitoring and evaluation of the Ghana School Feeding Program. Next slide. Next slide. Hello? Hello? Can you hear
Hi,
me?
Matilda. Which slide do you want to be on?
Okay. So the Ghana School Feeding Program is a government initiative that started in 2005 under the Comprehensive Africa Agriculture Development Program. It has national coverage and targets schools in deprived communities. So just to give a brief background on monitoring and evaluation in the Ghana School Feeding Program, this chart in this slide is from the first operation manual of the Ghana School Feeding Program from 2005. And this chart attempts to show a logical framework for the Ghana School Feeding Program, showing the long-term outcome of reducing poverty and improving food security, and also shows the shorter-term nutrition, education, and agricultural objectives. So before 2015, the literature and evaluations of the Ghana School Feeding Program pointed out that the program needed a comprehensive monitoring and evaluation plan, and also monitoring and evaluation tools to help better monitor the program. Next slide. Next slide. In line with the recommendations from the literature, the Ghana School Feeding Program, with the help of UNICEF Ghana, developed an extensive monitoring and evaluation plan with a detailed logical framework, which is shown here, and also monitoring and evaluation tools to be used for data collection activities. And this plan is from 2015. Next slide. So the new tools developed include the daily monitoring tool for the head teacher, the daily monitoring tool for the caterer, a procurement tool for the caterer to monitor purchases on daily, weekly, monthly basis. And then there's a school term monitoring tool and the school sanitation and facilities monitoring tool for spot checks at defined periods. Next slide. The first two tools shown in the previous slide are for daily monitoring of meals served and prepared respectively. They were designed to be used together with a partnership for child development's local meal planning and portion sizes using local handy measures like the one shown in this slide. Next slide. So with this background, the objective of my project was to conduct a pilot study to assess the feasibility of using the new Ghana School Feeding Program tools in monitoring and evaluating the selected output and outcomes of the Ghana School Feeding Program, with a specific focus on the nutrition quality of meals and the link to local agriculture. Next slide. My project was conducted in Ghana, West Africa, where I selected 3 regions to represent the North, Middle, and Southern belts. And we also selected 2 districts per region, and then randomly chose 3 beneficiary schools in each district. Next slide. Next. A study included both qualitative and quantitative methods. And what we did was to train caterers in food to use the monitoring and evaluation tool in monitoring the Ghana Food Feeding Program for food term. We also trained district desk officers and regional monitoring and evaluation personnel. The monitoring and evaluation personnel collected data using the new tools for a school term, and at the end of the term, interviews were conducted with these personnel to understand their experiences with using the new tools. Next slide. So in addition to calculating the nutrition output indicators listed in the monitoring and evaluation plan, I will be analyzing outcomes like meal diversity and the nutrient content of meals, looking at the relationships of these outcomes with some of these independent variables listed here using linear mixed model. Next slide. So due to some of the delays that we have experienced so far, the qualitative analysis is still in progress. However, I would like to share with you some results from the qualitative analysis and also talk about some key challenges that we experienced during data collection and the analysis to this point. So first of all, I will share with you some challenges with data collection. A key unanticipated challenge that we experienced was the caterer labor strike. Our scheduled training for the project were delayed as a result of caterer labor strikes for payments of feeding arrears. We therefore had a data collection period of 8 weeks instead of the 12 weeks expected. There were also challenges with the completion of the daily feeding monitoring tools, where foods that were commonly used were either not available or assessment of amounts of some listed foods were not feasible. Another key challenge was the lack of commitment of our district desk officers who were at the district level to coordinate Ghana food feeding program monitoring and evaluation activities. Next slide. So based on these challenges, the lessons learned are, first, there is a need for monitoring tools to be developed in consultation with the users to help address practical concerns earlier in the process. It is also important to address issues with tool usage that come up from pre-test before actually implementing the tool. And also, for monitoring to be effective at the district level, we recognize that there is a need for a paid monitoring and evaluation coordinator at the district level who is dedicated solely to Ghana food feeding program activities. Next slide. So what are some of the challenges we have identified so far in our analysis to this point? The monitoring and evaluation plan, when it was developed in 2015, had the intention of developing a management information system. However, this management information system has not been developed till present. The lack of this MIS makes data analysis very burdensome and prone to mistakes. Also, the structure of caterer and head teacher tools do not allow easy analysis of the food composition, which is needed to assess the nutrient quality of the meals that are served. Access to a good nutrient database of local foods will also be needed to determine the nutritional quality of the meal. Next slide. Again, looking at these challenges and the limited data analysis experience of the regional monitoring and evaluation personnel who will typically be responsible for analyzing the data, we learned that a functional monitoring and evaluation system is needed to ensure sustainability of monitoring activities. Again, the monitoring and the management information system will be needed for data entry at district and regional level to reduce the errors that are possible to show up. And there will be a need to develop a simplified monitoring and evaluation tool that can verify the use of the meal plans, recipes, and portion sizes to help establish nutritional adequacy of the meals. Next slide. Our findings from the interview show that, first of all, there was a high respondent burden for both caterers and head teachers from the forms that we trained on. And often the daily monitoring was not achieved. The daily tools were completed either at the end of the week or every other day. According to caterers, the amount allotted for a meal per child, which is 80%, about an equivalent of 25 cents, is inadequate for preparation of nutritious meals. And also, the desired length of caterers to local smallholder farmers is illustrated by the late payment of caterers. Fourthly, an interesting finding that we found was that the head teachers believe that they should be compensated for collecting Ghana school feeding monitoring data. And there are also delays in the reimbursement of caterers, which definitely affect the nutritional quality of meals. Next slide. So based on our findings so far, I recommend that training on PCD's meal planning, recipes, and portion sizes be provided to caterers and head teachers to assist with preparation and serving of nutritious meals respectively, and also to help with reporting of accurate quantities and portion size of meals. When we look at the high, next point please. When we look at the high respondent burden of the tools and the inability of the personnel to complete the forms daily, I recommend that a more simplified tool, maybe in the form of a checklist, which is linked to meal plans and portion sizes, be used for routine monitoring. And then these new tools that have been newly developed can be used in a subgroup of schools at defined time points throughout the year. Thirdly, I recommend that there's a need to revise the amount allotted for meals per child, because it affects the link between the nutrition program and to local agriculture. The 80 per square was seen to be inadequate for preparation of nutritious meals. Fourthly, when the new tools are eventually introduced or rolled out by the Ghana School Feeding Program, it is essential that a functional MIS is available for collating and monitoring data and to inform program decisions. Manually calculated summaries by district and regional personnel are highly prone to error. Next slide. And finally, better communication and strategies to promote ownership of the Ghana School Feeding Program by all collaborating ministries, including the Gender, Children and Social Protection Ministry, the Ministry of Health, the Ministry of Agriculture, Ministry of Local Government and Rural Development, is needed to improve sustainable monitoring of the program. Next slide, please. I would like to conclude with this quote. I believe it gives insight into what might be driving the ability of the program to meet its nutrition objectives, and also its link to local agriculture, and inclusive of the willingness to participate in monitoring. This quote was a response from a caterer to the question, what motivates you to continue working with the Ghana School Feeding Program? I read the quote. You see, personally, it's a passion. I have worked with children all my life. I care about the welfare of children. It wouldn't be so bad if the government could pay us on time. Thank you for your attention. Thank you.
Thank you, Matilda, for your presentation and for sharing your work. We're going to switch gears and focus on child nutrition in the home now with Dr. Nitya Mittal, who is currently conducting research at the, Columbia University. So please join me in welcoming Nitya to the presentation.
Hi, Zach. Am I audible? Hello?
Hi.
Hi, can you hear me?
Yes, we can.
Thanks. Thanks for the introduction. Good morning, everyone from New York, and thank you for joining this webinar. I am a little ahead of being midway in my fellowship, so this is very much work in progress. So I'm just going to present an overview of what I'm doing. The primary objective of my work here is to look at intra-household allocation of resources to young children in the age group of 1 to 6. Next slide, please. So when I say resources, I am looking at allocation of calories to these children. And the motivation for this study comes from the fact that availability of food is not the only factor that ensures or that affects allocation of food to young children. It is not the case that if a household has enough food, then it will ensure that the child is not undernourished. There is evidence that there are undernourished children in households which have adequate resources as well as in those households which have inadequate resources. And this is true not only of India, but is also true of many other countries such as Philippines, Sri Lanka, Nigeria, USA. So our objective is to find out how these households differ behaviorally. So what makes a household allocate enough food to child when it has enough resources versus a household who has enough resources but yet does not allocate enough to the child. So what are the factors that differentiate these households? And to do that, what we do is we look at the pathways that affect allocation of calories to children, which has been identified by UNICEF. According to that framework, mother's nutritional knowledge, her bargaining power, the health environment in which a child lives, total resource availability at the household level are some of the factors that affect the allocation of calories to children. In addition to that, we also consider the investment motive which comes out from overlapping generation models, which says that parents are going to invest only in those children which will have higher returns in future. So we look at health endowment of the child as another pathway. Taking all these pathways together, we see what are the how important are these pathways in affecting allocation of calories to children, and whether the role of these pathways differ depending on the availability of resources at the household level. Next slide, please. The data for this study comes from a primary survey which was conducted in 300 households in 4 villages in Bihar in 2013. We collected data through a household instrument, and we collected 24-hour dietary recall data for the child, his or her parents, and the total food consumed by the household as a whole, which gives us an estimate of total resources available at the household level. The data collection for the study was funded by the VDSA project of ICRISAT, and what we then do is we use switching regression models, which allows us to account for the fact that total resource availability and allocation are simultaneous decisions made by a household. So we cannot assume exogeneity of total household availability. And what our preliminary analysis suggests is that the pathways indeed differ by household resource availability. So if households do not have enough resources, they focus more on the investment motive. That is, they allocate more resources to the child who they expect would have higher earnings in future. However, if you have enough resources, then the other pathways, which is the nutrition knowledge and the bargaining power of mother, are more important in determining how much food is allocated to the child. What this tells us is that the kind of policies that are followed, which just looks at how to augment the total food availability at the household level, may not be the policies that will work for all kinds of households. So just increasing total availability will not affect or will not improve nourishment status of children who are in households which have adequate availability, but because of lack of knowledge or because of lack of mother's say in decision making, do not get enough food. So we need to improvise on our policy design, and we have to bring in more factors and account for that. Next slide, please. My study has 2 parts. So the second part is looking at the measures. So measuring nutritional intake is a very difficult task. There are different tools that are available and are used in practice, and these tools differ in the cost and their accuracy. For example, the dietary recall surveys or the Wayman methods which are used to get an estimate of calorie and micronutrient intake, and these are called gold standards, but these are very expensive surveys. They require a lot of money and a lot of time, but they are very accurate. On the other hand, we have other measures such as food frequency and consumption expenditure over past week or over past month. These kind of instruments are relatively cheap to administer, but they do not give as detailed information. For example, if you look at consumption expenditure, it is collected at the household level, and it will not give us an estimate of individual level of consumption. So a second part of my work here as an IMMANA Fellow is to validate the use of these alternate measures against the gold standard. So I have collected data on food frequency for the child and consumption expenditure over past 1 month, and I compare it with the gold standard, which is the dietary record. Today I'll present, next slide please. Today I'll just talk about a comparison of food frequency with dietary record for young children. Using the food frequency data, we construct two dietary diversity measures. One is the food consumption score, which is given by the World Food Programme, and the other is the dietary diversity score, which is advocated by FANTA. And we compare it with the estimates of calorie, vitamin and iron intakes, which we get from dietary record. What we find is that for both these measures, there is a positive correlation between these measures and intakes. But if we look at, if you try and identify the cutoff below which we can say that these children are undernourished or they have lower than required intake, we are not able to identify a cutoff for using these two measures. The next thing that we are going to do is we are going to look at the consumption expenditure data and compare it with the dietary record. Given that we also collected dietary recall data for the mother, father and child, we can also estimate how good is, if you look at consumer units and how well can we get an estimate of per unit consumption from 30-day recall, which is generally done in literature. So it will, what I'm trying to say here is it will give some sense of how well we can get information about intra-household allocation using 30-day recall. Yeah, that's it. Thank you.
Thank you, Nidya. We are now going to hear from our last fellow of the day, Dr. Megan Bruce, who will be working on food systems with animal source foods. She is of the Royal Veterinary College, and join me in welcoming her. Thanks.
Thank you, Zach, and welcome everyone. Thanks for listening in. I just wanted to present my fellowship work, which was in Tanzania, and we were interested in the relationship between animal health interventions and child nutrition. And our innovative tool was looking at system dynamics as a potential for measuring the multiple pathways. Oh, next slide. So system dynamics, keep going, sorry, Zach. I realized I put lots of animation in here, which may complicate matters. Anyway, so it's a methodology and mathematical modeling technique for framing, understanding, and discussing complex issues and problems. Next. So we have a food system here, which is the linkage between the animal production systems and the household. And within the household, we have children with individual nutritional needs. So from the livestock production system mainly comes food, income, and an asset store. And from the household, we have labour and husbandry, animal husbandry, which affects how the livestock production system functions. And within that household, there are decisions that are made both at how the livestock are kept and also how children are given food and how food is distributed within the family. Next slide, please. So system dynamics is an iterative process, and there are 5 main steps. Next. So the first stage is problem identification. So we identify what the problem is and how best it would be to address it. Next. The second component is conceptualizing the framework. So we develop a causal model and theory about how the livestock production system and child nutrition are interlinked. Next. And then we formulate the model. So we allocate data and quantify the model using the data that we would like. Fourth. Oh, sorry, next. Sorry, Zach, I'm confusing myself. The fourth step is model simulation. This is where we run the model and we can change different parameters within the model and see how the model functions. And next. And the fifth stage is how the model is then going to be used. So how are we going to use this to develop more improved nutrition-sensitive agricultural production systems. Next. Is that working, Zach? Oh no.
Hi Megan, are you able to see the next slides?
Oh, I'm stuck halfway through slide 3, I think. It just said the connection was lost, but then it suddenly come back on, so I don't know if I'm live or not.
Is the next slide the problem identification slide?
Ah, yes. Thank you. Yep. So we have our problem identification was child stunting within rural households. So we focused on an area of central Tanzania where there's a larger project running, which is looking at poultry and crop integration and how these interventions within, I was looking specifically at poultry and small ruminants, but how these interventions for animal health can help to improve child nutrition. But some of these things are quite hard to document. So the idea was using a system dynamics model where we have feedback loops and we can see how all these models are joined together. So next, the model conceptualization section. There are 4 broad pathways which are well documented. So there's income from agriculture, which is then used to buy food to be distributed within the household. There's the consumption of the production that's actually on farm, and these are linked and affected by broader social cultural factors, which include gender and the food environment, so prices and availability. And as I was saying before, all these pathways are interlinked. Next slide, please. So we use focus group discussions and interviews to develop the framework. So we're actually looking specifically at how intra-household dynamics from the livestock production system through to consumption and nutrition of children. And so we developed the conceptual model from those interviews and focus groups. Next slide, please. So this is a model of our framework. I don't know what you can actually see, because for me the screen has actually frozen. But basically we have the poultry flock, and then we have outflow from this, so birds that are used for home consumption, birds that are sold, some that are gifted or exchanged for other livestock, and others that are kept to increase the size of the flock. So one of the main problems we have is disease within these family poultry flocks, and which can cause deaths, so mortality. And then we have household indicators, which are then linked to the nutrition-specific indicators for children, so dietary indicators, and more proximally the nutrition indicators, so height for age and weight for age. And then overarching these are the intra-household dynamics. Next slide, please, Zach. So for the model formulation, we used data from the broader project, which was called Strengthening Food and Nutrition Security through Family, Poultry and Crop Integration in Tanzania and Zambia. And we collected primary data from small ruminants, but I don't have time to go into that model in detail. Hi, Zach. Can you hear me?
I have it on model simulation and analysis.
Oh yeah, perfect. Good one. Okay, so yeah, I'm not sure if you've been able to hear everything, so hopefully it's working again now. So there's a positive, so for our model simulation, we used Newcastle disease vaccine to try and reduce the amount of mortality or death occurring with the livestock, excuse me, the poultry flock. So we found a positive link between the number of chickens and both the home consumption and sales rates. So both the home consumption pathway and income pathways were improved when we increased the number of chickens. There was also a positive link between food security indicators at household level and then at child level, the dietary indicators. But these were the child dietary indicators were only in the small size households. We saw a weak link between the offtake rates, so the amount of chickens that are used for home consumption or sold, and how these actually went all the way through to the child nutrition indicators. And we also found that if we decrease poultry mortality, we simulate decreased mortality, we did see increases in home consumption and sales, but unfortunately in the first year the Newcastle disease vaccination only had varied effect on mortality. So there wasn't a true link all the way through. Next slide please, Zach. So how can this model be used? Next. We can use some of these intermediary indicators along the pathway to see whether maybe home consumption is a better component or a better pathway than income effects. So should we be promoting the increasing consumption of chickens rather than increasing the sale of chickens? We can also simulate some what-if scenarios, so we can change the frequency and timing of vaccination to see whether changing slightly the animal health intervention may lead to different changes along these pathways. Next. And we can use it as a predictive tool. So if we have a program that we want to implement in a certain area, we can use this model to see whether or not the intervention may actually be successful or what we need to add. So is there different nutritional education that we might need to add into this program to make the process effective. Next. And we can also adapt this model to different situations, to different parts of Tanzania or more globally in different communities around the world if we can implement the model using the local data. Next. And we can also extend the model. So basically we can add different components in. We can add a crop component into the model. We can add variation in terms of seasons. We can also add climate factors and soil structure. So next. So we've demonstrated proof of concept that system dynamics is quite a handy tool for looking at the different pathways and the relative contribution of these pathways from animal health interventions to child nutrition. Thank you very much. Next slide. So I'd just like to thank you all for listening. I've lots of people that helped me and supported me along the process. Jonathan Rushton was my home mentor at the Royal Veterinary College, and Dr. Puhara, who is my host mentor in Tanzania. And the Australian aid was this actually implemented the larger project, which I use most of the data from. Thank you.
Thank you, Megan, for your fascinating presentation. Our final presenter, Dr. Bekele Megesa, is unavailable, unfortunately, due to internet issues. So we're going to move ahead on to the questions. And just as a reminder to everyone, please send us some questions. We can view them through the chat box. All you have to do is go to the chat box, down to the drop-down menu, and select Send Questions to Staff. But we're going to start off with a question. I believe it's for Matilda. Hold on, let me unmute everyone first.
Hello?
Hi, is everyone here?
Yeah.
Great. So I believe this first question is for Matilda, but it is what amount of allotted money would you recommend for each meal per child?
Can I go ahead and answer now?
Yes, go ahead.
Hello?
Hi, Matilda.
Yeah, can I go ahead?
Oh, yes, go ahead.
Oh, okay. So that's a good question. It's a really good question. And there's been a lot of debate about what amount is ideal and whether there should be a different amount for rural communities compared to urban schools. But my take on this, based on my experience in planning meals in the present department that I am in now, I am a faculty person at the Department of Family and Consumer Sciences, and we do a lot of meal planning on a low budget. So based on the work that has been done here for a while, I think 2 cities, which is the equivalent of I think about 50 cents, will be ideal. 50 cities per child. That is 2 cities per child, 50 cents per child will be ideal. And I think a lot of stakeholders agree on that, but the variation is usually between 150 cities, one city 50 pesos, that is 1.50 cities, and 2 cities. That would be my recommendation.
Great, thank you. And just to clarify, that question was from Meve Kibere. Our next question is to Megan from Julius Tunamasico. So Megan, how do you categorize things like manure, which are used by the households that come from animal production? Hi, Megan.
Oh, sorry. Can you hear me? Yeah.
Yes, we can.
Oh, sorry. Could you hear me before? No. Yeah, I'll start again. Just to say the question about the use of manure it's really important, and if we're looking at a larger food system where we've got more environmental components, so using that manure for crop production, or it can be used, it can be sold, and also can be used as a building material or a fuel source. But we actually found in our 2 villages that we focused on the questions about the use of manure, only 2 farmers said that they actually used it for anything, and that was used for fertilizing the crops. So that was about 4% of farmers in the broader community, we estimated. So it's very low, and that's a good point, and that was going to be our focus for further work, is to see why it potentially wasn't being used.
Great, thank you. This next question is from Cecily Yelsberg, and it's for Cynthia. So Cynthia, there has been quite a lot of discussion to include men in family planning and childcare for decreasing the high workload of female farmers. Do you have any suggestion on how this could be put into practice?
Hello, sorry, mic issues. But yes, that's a great question, and there has been suggestions that there is a lot of work that needs to be done to include men, and not just in the ARG activities, but also, as I say, that any interventions would also have to include defeminizing many of these household chores, because in many cultures and in many societies, many of the work that is done by women is perceived to be feminine, and there are a lot of cultural and traditional implications for men participating in such activities. So definitely there is a need to involve men, but more on a cultural dynamics and cultural change perspective, so that they are less feminized.
Thank you, Cynthia. Our next question is to Nitya from Pinky Mondal, who is also from Columbia University. I don't know if you guys know each other. Do you think it is possible to get a reliable version of intra-household food allocations within children from parents? The question, she was particularly thinking about the gender dimension here. So if a boy is getting more nutritious food compared to nutritious food compared to a girl, is it possible to capture that through recalls?
Yes, I think we can do that. So if I understood your question correctly, that what you mean is whether you'll get a correct estimate or whether there would be biases in response when we away. Is that right?
I think so.
Yeah, so I don't think that was a problem. And what we did was we sensitized our respondents a day before the survey was done, and we also gave them out plates, because it's common in India for children to eat from along with parents. So we gave out different utensils to be used for the child, and I don't find, at least in my personal experience, we didn't find that they were misinforming us, and what we expect is actually showing in our data, in our results. We do find that boys are given better food. So I don't think this is coming from misinformation, but this is coming from practice, which we expected.
Great. This next question is for Rosemary. Rosemary, this question is from Dr. Elengarmi Sauli. This question is, what do you think were the reasons or mechanisms behind variations of iron and other micronutrients, for example, calcium, in your first objective model?
Hello?
Hi, Rosemary.
Okay. Okay, so some of the reasons that I think may have caused that was really reallocation of resources over time, over the period of the survey. My assumption is at that point when, for example, those that actually went down, their consumption went down, most likely could have been because of increase in prices for those particular food types, so people probably reallocated their resources to the cheaper options.
Great, thank you, Rosemary. This next question is to Cynthia. This is Julius Tunamasico again. He wants to know, how did you analyze the data from the focus group discussions? Hi, Cynthia. Oh,
hello. Oh, okay. It took a while for me to be unmuted. So we used content analysis. We did 2 rounds of of the focus group discussion. So we did focus group discussions with the women originally, and then analyzed those data using content analysis. Although we did have some a priori ideas about what we would find, and then based on our analysis from that first round and what more we needed to develop or more information that we needed to gather, that informed our second round of the focus group discussions, which were also then analyzed using the content analysis.
Great. The next question is from Ekin Birol, who also offers congratulations to all of you. But this question is particularly for Nitya. So in your analysis, will you be looking at gender differences and birth order?
Can you repeat that, Zach?
Okay. Will your analysis look at gender differences and birth order?
Yes, we did account for that, and we find that in resource inadequate households, there is preference given to the male child, but that's not the case for households which have adequate resources, and birth order was not a significant determinant in any of the 2 types of households.
Great. This question is also from Dr. Elangarmi Sauli, and it is for Matilda. So Matilda, why do you need so many monitoring and evaluation tools for the school feeding program? And what were the challenges in the program in the first place? Could you not have one monitoring and evaluation tool in place to address all the challenges?
Okay. Hello. So if I understand the question well, he's asking why there's not just one single evaluation tool, monitoring and evaluation tool. Is that correct?
Yes, I believe so. And then also in the first, or before these tools were introduced, what were challenges that the program experienced?
Okay. So before the new tools were, and these tools have not been introduced on a large scale. What I did was just a pilot study to see the feasibility of introducing the tools. Okay. So we just tried it out on a short term to find out. But I think the challenges before in terms of monitoring was that there was no monitoring tool at all in existence. So the only kind of monitoring tool that was available was a really simple invoice that caterers will write their number of cooking days, that's the actual number of days that they serve meals to the children, and this will be passed on to the district, to the region and national, so that the amounts that they need to be paid are sent to them. And basically that was the only information available. So they have an idea of how many children were fed and how many cooking days were used. Basically that was all that was available. So there was no monitoring and evaluation plan in place, and that was difficult to monitor anything at all. Okay. But I think the whole point is that using just one monitoring and evaluation tool would be difficult and maybe insufficient, because there are several objectives of the program, and there are several outputs indicators that need to be calculated if you're looking at the extensive logical framework of the program. And that's just one tool will be inadequate. In my recommendations, I am suggesting that a simplified version of the tool be made for routine monitoring, and then these detailed tools that I shared with you today can be used in a subgroup of beneficiary schools at defined points throughout the year, or maybe yearly, to give that kind of in-depth data that it provides because of the high respondent burden. Thank you. I don't know if this answers your question.
Great. Thank you, Matilda. So we're going to close out with our last question, and this is from Sophia Kalamatianu, who has a question for Cynthia. So Cynthia, through the discussions, did you see any potential for behavior change? Because they seem to acknowledge that it's a matter of culture or tradition, do there seem to be any potential for change, or is it just accepted that these are norms?
So yes, I do see a lot of potential for change, and I think there was one quote in my slides that where one of the men say that we can do these things, but then it's just a matter of culture. And I think culture is something that is very dynamic and that can be changed. And I know of some ongoing work in Malawi and in Kenya where and even in Zimbabwe, where they're trying to change these gender norms. In some cases, not focusing specifically on the activities or household chores, but I think if some of these gender norms can be changed for other things, it can have a rolling effect on the work that unpaid, who performs unpaid care work. And so I do see potential for change.
Great. And we're actually going to take one last question. So this is for Megan from Dr. Elangarami Sauli again, who wants to note the lack of food and nutrition components into the dynamic models, and only on animal health and child nutrition. So perhaps you could just that point and close it out for us.
Oh, sorry, I missed the note that there was missing. What was missing? Sorry.
That there isn't a food and nutrition component in the dynamic model.
There is. There's a section there for at household level. We looked at dietary diversity at a household level, and we used individual dietary diversity scores at individual level for the children, and looked at how much of how many times a week they were eating chicken, how many times they were eating different small ruminant meats. So I'm a little unsure of the question. Sorry.
Oh, there's a follow-up that I just saw. Were there any agriculture or food products added to the consumption component?
As so not animal source foods, are you asking? Mm-hmm. Yes, so we had we looked at 24-hour recall for the food for the children different points throughout the year. So we can segregate out. So we did a dietary diversity score, but it was using food recall. So we could look at different groups of food. So that was a very simplistic model, but there's a lot more that we can that we actually did with it, but just limited time to kind of explain it.
Mm-hmm. All right. Well, that's all the questions from our audience today. But I do also want to note that if anyone in the audience has further questions, please email us at immanafellowships@tufts.edu, and we can be sure to put you in contact with any of the fellows or staff today. I also want to note too that unfortunately Dr. Regression wasn't able to join us, but we will definitely put his slides and presentation on the website for you all to view. But I just also want to finish up and say thank you to all the fellows, Rosemary, Cynthia, Matilda, Nithya, Megan, and Bekala, for presenting your work, and thank you to everyone for attending today's aptly named webinar. And again, just to plug, if you are interested in applying for round 3, please visit our website, reach out to us, and join our informational webinar that we'll be holding on Thursday, December 8th. The registration link can be found on our website under fellowships. I'll be sure to send out some communications over the listservs that I'm sure you all found this webinar on. But on behalf of IMMANA, the Tufts University Friedman School of Nutrition, and our presenters, thank you for joining us today, and have a great rest of your week. So thanks, everyone.
Thanks, Zach.
Thank you.
Thanks, Zach.